What are your thoughts about this growing trend in the teen cosmetic procedures?
Well, Satori, I think that can be concerning. I think there's an appropriate time for a teenager to have plastic surgery or cosmetic surgery, and it really needs to be for the right issue or problem. And there are times when we're operating on young girls who are in their early teens, mid-teens for rhinoplasty. Well, if somebody has a significant nasal deformity that really is impacting on their self-esteem, they're definitely going to benefit from having a cosmetic procedure at a young age. And there are some males as well, but usually we want to make sure that they're mature enough to handle that. And the young ladies tend to become a little bit more mature quicker than the boys do. And then even for other procedures, there's times when we may do an otoplasty or ear pinning on a young child, even as young as 5 or 6, because that's the age when they start interacting at preschool and getting teased by others. And really by that age of 5 or 6, that's when about 85% of the ear growth has occurred, so it's an appropriate time to operate on them. Now when you talk about other procedures, say breast augmentation, it really depends on the person and the individual and their circumstance. Do they have a breast deformity that's really embarrassing? That's something where when they're interacting with their classmates or peers in the locker room, that's really affecting their self-esteem. Now, if we look at other patients as they get into their later teens, I mean, if you look at it, 19-year-old women, they're teenagers still, but most plastic surgeons would think that for an appropriate 19-year-old, for the right situation, it's okay to perform a breast augmentation, even for an 18-year-old, for the right circumstance. I think you have to be careful when we're looking at those under age 18, and really you want to have the parents involved. But generally we like to wait until age 18 at least before performing breast augmentation on most patients.